Hello, my name is Dr. David Robert Miller. I'm a hand upper extremity specialist at Town Center Orthopedics. I've been in practice here for 23 years now. I'm board certified in orthopedic surgery as well as hand surgery. Yeah, our typical patient with early onset of carpal tunnel symptoms will present oftentimes with complaints of numbness and tingling in the radial 3.5 digits, that being the thumb, index, long, and half of the ring finger. They common will complain of waking up at night with pain, numbness, having to shake their hands out. Their numbness will also occur while driving at times or typing. They'll frequently have to stop and again shake their hands out in order to alleviate those symptoms. The pain sometimes can radiate up into the forearm and even as high as the upper arm. We've seen it. In those typical patients, we will do a test on them on physical exam, Phelan's test, Durkin's compression test, and if we can reproduce these symptoms on exam, that verifies the diagnosis oftentimes. I will implement full-time splinting at night initially for the milder cases or patients that do not have any evidence of nerve damage. And if they have significant relief of that, that's all they may need in terms of their treatment. For those patients that come back in 4 weeks that have persistent symptoms, I would then go on to an ultrasound guided injection in the carpal canal. Oftentimes you're going to get relief of that. That might not always be a cure, but oftentimes will alleviate the symptoms significantly. And sometimes that can help for the long term. For patients that have failed conservative treatment, which included splinting and injections and modification of activities, we have a great procedure. I usually use a mini open approach under local anesthesia only. These patients are oftentimes diagnosed with the carpal tunnel by physical exam history, confirmed with ultrasound, and they can often book for surgery if they have failed conservative measures. That procedure takes approximately anywhere from 3 to 5 minutes to do through a small incision. The pressure is alleviated off the nerve. The symptoms of numbness and tingling that come and go are typically alleviated immediately. Any baseline symptoms that are there all the time, we call it static symptoms or widening of their 2-point or weakness in the hand, I will often explain to the patient can take months to return, but usually will continue to improve for up to a year. Most patients are very happy and satisfied with their release and with the relief of symptoms. It's very important to educate the patients on what the appropriate expectations should be, depending on the degree of carpal tunnel symptoms they are having, any static symptoms or advanced findings that we have, because those patients are going to take longer to recover, and they need to know that. If they're aware of that, then they understand and they buy into their treatment regimen, and they understand what the expectations are. Patients usually, again, their expectations are well met. This is a very successful procedure. Patients do very well, and in most cases are very happy with their outcomes.